Hi, my name is Dr. Singh. I'm an ENT consultant. How do we clean the ear? This is a very common question. The truth, however, is that you don't need to clean your ear regularly. If you have a normal ear with a normal amount of ear wax, which is the case in 95% of people, you don't need to do anything about the ears. Just let them be. The most important thing is to not try and clean the ears with cotton buds. Buds tend to push the wax deep inside, causing problems. If, however, you do suffer from a buildup of ear wax, especially if it is dry and hard, if it causes pain or itching or blockage of the ear, then you can use drops, wax dissolving drops or olive oil, 2-3 drops once or twice a day to soften the wax, lubricate the canal skin. And if you really need to clean the ear, then the best way is to come to an ENT doctor and get him to do it by suction clearance. Ear infections are common ear problems. They typically present with blockage of ear, pain in the ear, and sometimes discharge coming from the ear. On examination, when we find these findings, it may indicate that their infection is either in the ear canal, and these patients will typically have a lot of tenderness on touching the ear canal, or the ear infection may be behind the eardrum in the middle ear. These are middle ear infections which happen typically after a cough or a cold. Typically, ear infections are treated by cleaning the ear out. This may require microsuction clearance. We put the patient under a microscope and clean out the ear canal, especially when there is fungal infection. Once that has been achieved, we instill antibiotic drops, which are very effective. The patient has to keep his ear dry and keep all water out during the entire period of treatment, because water getting into the ear will delay treatment. We sometimes also need to use oral antibiotics and anti-allergy medications or drops to help with this. So if you suspect that you have ear infection because of pain or blockage, the best thing is try and avoid water getting to the ear. If required, use cotton smeared with Vaseline as a plug. Do not let water in, keep the ear dry. There's a good chance that these things will heal on their own.